And let's begin this conversation by briefly discussing what ARTs are.
So in the normal reproduction process, what happens is there is an egg, new human being, a baby is going to be born.
So what are the different types of ARTs available?
Technologies which we have, one is the IVF, in vitro fertilization. Another option, intrauterine insemination.
Would like to know what is the scene in India when it comes to ARTs.
Actually, I think this should be one aspect we should be very proud of. We are very advanced when it comes to ART technologies. Like we had Wiki Donor, which spoke about artificial insemination through a sperm donor.
Hello and welcome to the conversational video series brought to you by VisionIAS. Today, we live in an ironic world in which challenges related to a rising global population coexist with issues pertaining to fertility and reproduction. And that's why in today's session, we're going to discuss a set of new technologies which are collectively called Assisted Reproductive Technology. And to enlighten us about the same, today we have with us an eminent faculty member of VisionIAS, Dr. Jasmine. Hello, ma'am.
Hello, Shiranjeet.
Ma'am, let's begin this conversation by briefly discussing what ARTs are.
So we are talking about assisted reproductive technology. That means we are giving some assistance to the natural reproductive process. So in the normal reproduction process, what happens is there is an egg which we get from the female body. There is a sperm which comes from the male body, and both of these cells, they will fuse, they'll form an embryo. This embryo will form all the parts of the body, and then a fully developed new human being, a baby, is going to be born. If there is any problem or any challenge in any of these steps happening naturally on their own, then we can develop some technologies, we can give some assistance to this process in our laboratory-based techniques. And when you apply those, that's what we say is ART, or assisted reproductive technology.
Okay, ma'am. Why is there a growing need for such technologies, not just in India, but across the globe?
You very rightly put this, that there is a definite increase which we have seen in the need for, or the demand, as we'll say, of ART. And the reason for that is very widespread growing infertility. That's one of the main causes. A lot of infertility or inability to conceive naturally arises from issues of overall changes in societies. Like you have the aspect of delayed marriages, where people are more focused on first driving their career and developing some basic financial stability before they choose to have a family. And beyond that also, even if it's not a matter of age, even if, because we say the age, say after 35 years, we find that fertility levels naturally will reduce. So there some assistance might be needed. But even without that, we have environmental impacts and impacts of our lifestyle which are contributing to people who are even much younger facing this challenge of infertility. The kind of diet which you have, the kind of substance abuse which people are involved in, say alcohol or smoking, that greatly brings down the fertility levels. Then you also have a very clearly understood impact of different kinds of radiations and blue light and screens which we are exposed to, which also tends to impact fertility levels. Along with that, we are living in a scenario where our environment is polluted, our food is contaminated, there is adulteration, and all of that also impacts the aspect of fertility. And on top of all of this, stress is one very big factor which kind of impacts everything in our lifestyle, every aspect of how the body will work. So that would also mean that you will need some assistance from technology. Along with that, there's one more aspect other than infertility, where we are evolving a world where new kinds of households are emerging. Households like a single parent household, same-sex couples, then ideas of live-in couples, or any such, you can say a different concept from the traditional idea of family. And these would definitely need some help from technology if they are supposed to procreate and have a child.
We rightly pointed out. That means most of these needs are because of lifestyle changes. So, what are the different types of ARTs available?
So what kind of a technology or what kind of a technique will be used will of course be dependent on what is the requirement, what is the case and what is the issue. The main technologies which we have, one is the IVF, in vitro fertilization. I'm sure everybody is now familiar with it because you walk down the road, you will see 3 posters asking you or telling you about an IVF clinic. So in IVF, what is done is that, like we were talking about the egg and the sperm coming together and fertilizing. So that's normally happening in the female body. But if we take that egg from the female body, we remove it, we bring it to the lab, we take the sperm, we bring that to the lab, and then we fertilize it in the lab. Once it fertilizes, once you have that developing into an embryo, then it is put back into the female body. It's transplanted again. So here the assistance has happened for fertilization. So if naturally conception is not happening, then it can be done in the lab and rest everything remains the same, then it is put back. This would be what we call a test tube baby. Then you have another option of doing an intrauterine insemination, in which the problem is in having a natural conception. So what can be done is a sperm sample can be taken and it can be inserted directly into the female body, so that you can have like a short way of making sure fertilization will happen. So in this, it's not happening in the lab, it's still in the female body, but the sperm comes from outside. That's where the technology will be used. So in a case where there is an issue of male fertility or male infertility, basically this technique could be an answer to that, right? Along with this, one other technology which I'm sure everybody is familiar with is surrogacy. So in a surrogacy practice, it will be an IVF process. In the lab, fertilization will be done, but now the transplantation is happening in a person who is not the biological parent. So it's not the people who have given the egg or the sperm, but a third female who will be brought in to carry the baby, to provide nutrition to this growing embryo and give birth. She'll not be biologically related, right? Because our biological characteristics come from our cells, which is the egg and the sperm. So let's say the female is not strong enough, or she has some disease, or there's some problem with her uterus. So she cannot hold that baby or grow that baby for 9 months. So a surrogate can be brought in. So she will hold the baby, she will be pregnant for 9 months, and then she will give birth to somebody else's baby.
Okay, ma'am. Now, after having discussed the techniques, would like to know what is the scene in India when it comes to ARTs.
So India, you will actually, I think this should be one aspect we should be very proud of. We are very advanced when it comes to ART technologies, right from the 1970s, right from the time where this technology of an actual test tube baby was developed. Within a few years of that, we had this technology developed in 1978, somewhere around that time, in India also. So we were very quick to get on board. And as such, medical professionals or medical services in India are very, very advanced. In fact, all over the world, we have Indian doctors practicing. So you have the aspect of that very advanced sense of technologies in India also. So we have a lot of interest in this, like we spoke about the demand. So because of that, we also had, from the very early stage, development of a lot of ART clinics. We provide all these technologies. We have IUIs very commonly done, the intrauterine insemination. We have IVF. We have surrogacy, which is again a big industry in itself in India. And all other forms of technologies, storage banks for storage of eggs, for storage of banks. We have all of that at the most advanced levels. And when it comes to a comparison with the rest of the world, that in terms of technology, we are at par. But in terms of cost, we are actually very, very affordable when it comes to, comparing it with the rest of the world. like the cost of an ART procedure in US, if you compare it with the prices we have in India. So we have, the price might be 1/5 or even 1/10 sometimes of the cost. So it's affordable for the rest of the world. Maybe for the people in India, maybe not everybody would be able to afford it, because if we look at an IVF process, so the cost can go in a couple of lakhs, maybe 1 lakh, 2 lakh, 3 lakhs, like that. It can go, and surrogacy even more expensive. The technique could be 10 lakhs or more also. So for people in India, technology is there, maybe not affordable for everybody, but for a lot of you can say middle class Indians at least, this is something which is very easily accessible now.
Okay, ma'am. That means the cases of fertility issues are rising, but the market is yet to be captured. I mean, it's going to take more time to get popular. So, what are the other challenges apart from the cost factor that you just mentioned?
See, challenges when it comes to using any kind of technology, I think the biggest thing, like you said, that it's not captured the whole market. The factor there is awareness. That's the big issue. That do people understand that there is such a technology which is available? And it's not just that. It's not just that you understand the technology or somebody tells you, okay, there's a procedure like this. Do you understand it in all aspects? Do you understand that, okay, what will be the side effects of this, or what problems can come, what challenges can come, what will be the future implications? So we don't have a lot of, what should I say, proper knowledge and information base which is there, especially because most of these procedures are in private sector, right? You have some government institutes doing these procedures, but it's mostly happening in the private sector, and there the angle of commercialization becomes very small. So adequate information might not be given, or proper right information might not be given. Then what happens is that there is this issue of, like if I talk particularly about use of donors, like for different ART procedures, sometimes if one part, the sperm or the egg, it's not working properly, you can get that from a donor. You can get a sperm donor, or you can get a egg donor, right? Like we have seen movies around this idea, like we had Vicky Donor, which spoke about artificial insemination through a sperm donor. So in that, when you have a donor, the issue of rights of that baby, right? Like biologically somebody else might be the parent, but there are two people, there's a couple who has come up to get the procedure done. So this child legally would belong to the couple, maybe not biologically. So there is this complication which sometimes comes in terms of rights of this baby, in terms of inheritance status of this baby. So that's one very strange kind of an ethical scenario which might come out of this. Then further, if I talk about surrogacy, this is globally being debated, in India particularly, because we don't have a very stringent regulation process. There is this challenge of exploitation of surrogates. People from all over the world, because like we discussed that technology is cheaper here, they come to India, they hire surrogates, and they might be exploited. Sometimes it might be a procedure which is done on women without their consent, or without proper informed consent as to what is happening to them. So their rights become a very important issue. Other than that, the idea of health in itself is very, very significant, because this is something, having a child, mentally it can be something which can be very exhausting, and physically also it does tax the body. And when you have to do clinical procedures, and when you have to do a lot of those testings, that might increase the level of despair of people undergoing this treatment. And a very strange thing here, if we look at the society, especially if you're talking about India, there is a lot of emphasis on having a child itself. Conceptually, why we have these technologies is because people want to have a child of their own. right? This childlessness, there's so much social stigma associated with it. There is so much turmoil which couples face, especially if they're not able to conceive naturally. So there is a lot of mental health related issues also, which would be there if people are choosing to do this process, or even if they are not doing, but they are suffering from that situation of infertility. That is a big problem. Another point which I will add here is the idea of what quality protocols are used in these techniques. We have so many techniques, right? We said that India is mushrooming with these centers, but the problem is they are not very well designed. We don't have a lot of system of very stringently checking that if everything that's happening there is going on properly or not. There might be some issues which might have come on how record keeping is done, on how techniques are administered. It might lead to loss of life also. So all of these are big questions of concern.
From what you said, that means challenges are many, and also there are ethical concerns, and there is a fear of getting exploited. So, how will the market is regulated in India?
So there, like I told you, right from the 70s, we have these technologies, but there was no law which was there to, take care of all these provisions. And there have been discussions for many years, like more than 20 years. There's been a talk of a legislative process, but finally it came through acts in 1921. So the idea first started with regulating the surrogacy industry, because it was very well prevalent in India. We have villages in India where the whole village occupation is to become a surrogate, and there was no law which was governing or protecting those people. So the first act which was brought in was the Surrogacy Regulation Act, 2021. And then while the discussion on this this bill was actually going on, it was decided that this is not complete. You cannot just talk about surrogacy. You need a ART Act also. You need to talk about all the assisted reproductive technologies. So that bill was also laid out, and you have now both these acts being passed by the government. So you have the ART Regulation Act and you have the Surrogacy Regulation Act. The provisions of the Act define who can avail these technologies, what should be their age, what should be their health status. All these aspects are defined. Then the Act specifically talks about a registry of, like, they are going to create a national registry of all ART centers. That means centers where this procedure will be done, and ART banks. ART banks would be banks we use this technique of cryopreservation, storing things at extremely cold temperatures. So eggs, sperms, embryos, they will be stored in those specialized banks. So they also need to get registered. The center also needs to get registered, and there will be a national board which will be advising the government from time to time as to what all needs to be done or what all rules need to be come in. Because along with the Act, they've also laid out a set of rules which will keep getting updated with time. The law currently talks about the quality protocol, that this is how procedure is supposed to be done, this is how record keeping is supposed to be done. And in case of any problem with this, in case of any of these rules being broken, there is also a provision of penalization. Penalty will also be there, right up to going to jail. Right. And for surrogacy also, particularly, one very significant regulation which has happened is that commercial surrogacy is now banned in India. The Act talks about only altruistic surrogacy. Altruistic surrogacy would mean that you cannot hire anyone to become a surrogate. Somebody with which has to be a close relative, out of the goodness of their heart, without taking any money, can choose to become a surrogate. But of course, we haven't been able to apply this very well. We still have that illegal racket of commercial surrogacy going on at a very large scale. And there are also arguments and views which talk about how if somebody is pregnant for a year, maybe that person is losing his job, or maybe he's not able to work completely. So some amount of economic compensation is needed in that sense. So maybe some kind of an updation will come over a period of time, but currently this is the situation.
That means despite having laws, the market is in a way slightly unregulated or underregulated. That's why we have surrogacy rackets. So what can be done, ma'am, in the future? Reforms, if you talk about.
So, if we talk about the reforms, I'll start by talking about the board, right? The national boards which has been set up, they don't have like technical members, like all the members ideally, because this is such a specialized technique, such a specialized field. So you need experts who will be able to advise, who should be able to advise. But you have like members of parliament who are a part of these committees, right? They don't have the technical expertise, they don't have that scientific knowledge to make rules. So that kind of becomes a very big problem. Other than this, in terms of like if you look at what is happening internationally, they give a lot of emphasis on quality assurance, on safety, and at the same time on counseling methods. Our system does talk about that you should be counseling patients, but that has not been followed as a practice. Government does not have any scheme which can be linked to it, but maybe government programs in general could talk about awareness of all of these. We need to really educate people to understand all aspects of this. That's one thing which is going to be the starting point of all kinds of reform. Another thing is that in a lot of places, when it comes to ART technologies, sex selection, or what you call as gender selection, is happening, right? And in India, that's something which is not allowed. Okay, you cannot get sex determination tests done. You cannot choose if your child will be a male or female. But in this whole process of there is assisted technologies, that aspect is something which is coming up. So regulations or any kinds of checks or inspections which are happening, they should be targeting that aspect. And that can be done by checking proper record keeping, if that is there or not. And of course some form of genetic testing could also be helpful. There is a provision in the ART Act which talks about that the embryos should be genetically tested before implantation. In that, this aspect is also something which could be ensured. In terms of the surrogacy aspect, like I mentioned earlier also, there are very strong views which talk about some aspect of economic remuneration which might smoothen the challenges of commercialization. So in a way, even in case of an altruistic surrogacy, some monetary compensation maybe would help us regulate and have like a better check on whatever otherwise is going to have happen illegally. Then one more very big challenge is that these laws, they are not very inclusive. As of now, the provisions of ART cannot be availed by single men, unmarried, divorced, widow, any of these situations you cannot get these technologies done. Then by same-sex couples, by transgenders, they cannot use these technologies to have a child. So that kind of puts a very big section out of this paradigm of being able to have a child. Even when technology is there, they are not eligible for the same. So maybe we need a more inclusive policy, of course with the best case of the most properly crafted, detailed rules. But technology per se is supposed to benefit everyone equally, right? So the act must ensure that that can happen.
Ma'am, because most of our viewers are UPSC civil services aspirants, would like to know from you what is the importance of this topic from mains and prelims point of view.
So from the exam point of view, when it comes to the specific techniques, That could very well be a prelims question, like what's happening in IVF, what's happening in IUI, what is the concept of surrogacy. That whole aspect of inheritance, as such, aspirants prepare also when it comes to their topic of genetics or biotechnology in GS paper 3, and for prelims part also specifically. So the technique is more likely to be asked in the prelims exam. From the point of view of mains, this would be, I think, more relevant to aspects of health, more relevant to ideas of social issues, can be a very, very important social issues. Like you have WHO now very explicitly talking about sexual and reproductive rights. So this, as a matter of right, can become a very important component where discussion on gender issues, gender identities, and reproductive and sexual health, when that is there. It's also a part of our sustainable development goals. So goal number 3 is about health and well-being. It also brings out this aspects within its ambit. So as an elaboration, as an enumeration of all these ideas where reproductive rights are concerned, this kind of a technological application will fit very well.
I think we have covered the topic quite comprehensively. Thank you so much, ma'am, for answering all the questions in great detail. Now, dear viewers, we hope you liked and enjoyed the session. We'll keep coming up with more such sessions. Till then, wish you all the very best.